Alberta Health Services' first Emergency Medical Services District Station is now fully operational in South Calgary. The 3,400 square metre Southgate District Station is the largest ambulance station in Alberta and the first of its type, bringing together EMS crews based in South Calgary under one roof. The base improves the efficiency and coordination of EMS resources, which allows vehicles to return to the road more quickly and respond to more calls.
For Calgary's own clinical operations, this is an exciting opportunity for us to go to a district-based model. From both the perspective from a staff deployment, where we get a cohort that come together from both the emergency, IFT, and community paramedic side to come together and stop their days together to start building that community of practice from a collaborative care model is absolutely fabulous. But also from an access egress, both to a major corridor along McLeod for emergency responses, but also to be centrally located between two large hospitals on the south side of the city, allows us to have resources deployed and accessed across the entire south side of Calgary in an efficient and effective manner.
Currently, EMS crews are assigned to a specific ambulance, which could be located anywhere within Calgary at the end of the shift. The ambulance must return to a specific location to switch over to the next crew. Under the district-based model, paramedic crews are paired with the next available vehicle that returns to the base, getting them on the road more quickly to respond to calls.
There's a couple of great things that go hand in hand with the development of this new building, and one of those is our ability to communicate with our staff in a different way. We get greater face time with our staff, more one-on-one time, greater access at the beginning and ending of shifts when we never used to really have that. So aside from us being able to become more efficient at the way we move our ambulances out of service and then back into service, we also have a greater opportunity to make sure that we're talking with our staff and having greater conversations more often.
So this is a large facility. We currently deploy about 30 ambulances actively out of this facility, as well as 2 community paramedic resources and supervisor resources. It equates to about 180 staff that will see their shifts stop out of this location.
You know, part of the great design that we put into this building also allows us to become very, very flexible with any changes that may occur within our system. And so therefore we can take this facility and actually put together either strategic teams or do some merging of work groups, whatever the case might actually be, without actually losing any of our momentum in our day-to-day work lives. So it's a great opportunity to be able to put working groups together and get some great efficiencies out of those working groups, no matter what the local conditions are.
So we're excited that operations have actually started deploying out of this location, and we started back in early April. The vision to get this facility to April took about 2 years, with 1 year of intensive work by the staff to get it to where it's at today. But we are actively deploying resources out of this facility today and have been for approximately 6 weeks.
If the district station model is successful, AHS will look to implement it elsewhere in Calgary and potentially across the province.